Oral anatomy, muscles of the face. This diagram shows all the muscles of the face. We'll be talking about the four major muscle groups. The first one is the masseter. This runs from the zygomatic bone to the mandibular border. It provides great chewing power, especially in the molar area, and its function is for closing the jaw. This diagram shows the location of the masseter muscles. Next is the temporal muscles. The temporal bone, parietal bone to coronoid process, and ramus. It has less power than the masseter, and it's used to elevate the mandible and close the jaws. Its function closes the jaws, retracts, and pulls back. This is a diagram of the location of the temporal muscle. Next we have the medial pterygoid, or the internal pterygoid. The medial pterygoid works with the masseter to close the jaws. Its function is to close the jaws, and it aids in protrusion. The lateral pterygoid, or the external pterygoid, opens the jaw and protrudes it. Its function opens the jaw and aids in protrusion, retrusion, and lateral excursion of the mandible. This diagram shows both the internal and external pterygoid muscles. Next we have the accessory muscles, the buccinator, the suprahyoid, the infrahyoid, and the Orbicularis Oris. The buccinator is the muscles of expression. It keeps the lips against the teeth, and it aids in the blowing action of the mouth. The buccinator is the principal muscle of the cheek. It draws the corners of the mouth laterally, compressing the cheeks as in whistling. The Orbicularis Oris draws the lips together. The infrahyoid and the suprahyoid, they aid in swallowing. The hyoid bone is the only bone in the body that is not attached to another bone. Instead, it is attached to the muscles of the floor of the mouth and the tongue. Supra means above, infra means below. The temporal mandibular joint. This is responsible for the movement of the mandible. It has a hinge action, that is, a swinging motion as the mouth opens, a gliding action, a movement towards the anterior as the mouth opens wider. The mandibula has movements of open, close, protrude, lateral, all directed by the TMJ. Then we have the muscles of the tongue. The extrinsic, which means outside the tongue, that assists in moving the tongue. Then we have the intrinsic, or inside the tongue. This assists in shaping the tongue. Vocabulary. Insertion. The end of the muscle that is attached to a movable structure. The origin is the end of the muscle that is attached to an unmovable structure. Smile!